Dr. Maya, welcome to the Further Forward podcast.
Thank you for having me.
You know what? It just feels even better that you're here after we've worked together. I knew that there was a reason why the timing would be the timing, because now I feel like
No, I agree.
I got to know you a little bit better.
Yeah.
I know your work a little bit better. So I think, I was excited before, and now I'm like, okay, let's really get into this.
Yeah. No, same. I was thinking the same thing. I'm like, I'm glad I got to meet her first, and then we're gonna do the podcast because now we have a little bit more understanding of what we both do.
Exactly. The first question of this podcast is always the same. Who are you and how are you?
So I'm Dr. Maya Lespinasse. I am a pelvic floor physical therapist. I'm the owner of Your Pelvis Physical Therapy, which is a boutique practice in Foxborough, Massachusetts. So I specialize in all women's health conditions, not just pregnancy, postpartum. My youngest client is 18, my oldest is 72. So whether it's urinary leakage, endometriosis, back pain, hip pain, pubic pain, all of the things, that is my focus. And then another big part of my mission is just educating outside of my practice. So I like to do a lot of pop-ups and workshops and all of that. And I'm good. I'm doing good,
Love it.
really.
So if someone has no idea about the pelvic floor, where do we start? What is the pelvic floor? Does everyone have one? Who should be paying the most attention? Can you give us if we're walking into a building, we're definitely on the first floor right now.
Right. Okay, so anybody that pees, poops, or has intercourse has a pelvic floor. Dogs, cats, men, women, babies, everybody has a pelvic floor. If you're breathing. So that is who has a pelvic floor. And where is your pelvic floor? It is within your pelvis. So it's a hammock of muscles that live within the pelvic bones. And they allow you to keep urine in, keep feces in, allow you to procreate, all of the things that we need to survive. But it's often a very neglected area. And that's why I like it. That's why it's my focus.
Okay, I was going to ask, did you always want to become a pelvic floor physical therapist? Did you know that this was a thing when you were a little girl coming
No.
up? Take us back
Yeah.
to who's 6-year-old Dr. Maya?
Yes. So I did not know what pelvic floor PT was, honestly, till PT school. Um, Young Maya was an athlete. She was a soccer player. She did karate. She was just a happy, fun kid. And in middle school, I was, extremely athletic, kind of like a tomboy. But I also really loved A Baby Story on TLC and 16 and pregnant. I had no business watching it, but I found it so interesting. I found it so interesting,
Yes.
and kind of fascinating. Because I was a soccer player and a goalie, I had a hip injury. So in 8th grade, I went to physical therapy and I was like, okay, this is kind of cool. I like learning about the body. At the same time, I still had that interest in babies, but I knew I didn't want to be an MD or an OBGYN. By the time I got to PT school, on one of my clinical rotations, there was a PT always going into a private room with pregnant women. So I asked to shadow her, and that was the bridge between those two careers for me. And that was it. So I took the extra coursework. So we learned a little bit about pelvic floor in PT school, but not a ton. So within PT school, I took the extra certifications in addition, and I've been a pelvic floor PT since I graduated.
Oh my gosh. Okay. So my first husband was a PT, and
Awesome.
it was very cool, very
Yes.
useful. It was terrifying when he's trying to practice manipulations on my neck, and I'm like, he's gonna literally snap my neck. But we never talked about anything pelvic floor. It was never anything that came up, not even in a way that was I hated this, anything. So all this time, I never had any idea about anything pelvic floor
Mhm.
really until pregnancy. Once you get pregnant, then you start gathering this
Exactly.
community of
Yes.
other people who want to tell you stories and want to tell you what to look out for, and you're just kind of like, okay.
This is the thing. Yeah.
Why is it literally just because it's around our genitals that no one has ever wanted to talk about
Yeah,
this?
I think so. I think it's
Yeah.
just it's a very personal thing for a lot of people. It's a very private, maybe embarrassing thing for people to talk about. So they just don't talk about it. Whereas if it's back pain or knee pain, they don't really care, or they just had a knee surgery. It's not a big deal to them. But
Yeah.
most people aren't going to say like, "Oh, I just had prolapse surgery," you know. So I think it's just because it's such an intimate area that, which I respect it. Like I don't think you need to share that information if you don't want to, but it's definitely contributed to this like secret society or this like taboo topic. Um, so that's kind of my goal is with my social media and with the workshops is just trying to, you don't have to come forward and say you're dealing with this situation, but I want you to know that you're not alone dealing with it. Yeah.
Yes. Can you tell me, so for the folks that you see that are kind of like outside of the ranges of reproduction, or even like not even outside the ranges, but also who maybe aren't even interested. Maybe they don't want to have babies. Maybe they'll never be pregnant or whatever. What are the things that you would treat an 18-year-old for or a 72-year-old for?
So younger, it's typically pelvic floor tension related. So
Okay.
that could be look like vaginismus or PVD. So typically that would be painful sex. Is probably the biggest
Okay.
thing that I see at that age. Um, a younger population too is like gymnasts and athletes that are experiencing leakage, and that's often due, especially if they've never been pregnant or had a baby. A lot of times that's due to pelvic floor tension, right? So I've had clients that are gymnasts, and when they land from the vault, they get leakage, and it's because that their pelvic floor is too tight that it can't contract efficiently enough when they hit the floor, so they experience leakage. Um, so that's typically the younger.
Wait, hold on. I gotta pause. Sorry, I like because I know I'm like, wait, how would someone who's younger, how would their pelvic floor become so tight that they would experience leakage? I mean, I know it's a muscle and muscles get tight. I would assume like any other muscle
Mhm.
that we have in the body. I can understand why my bicep might be tight, but like, why would a pelvic floor be tight?
I think a lot of it is just unawareness. So, like, they may be overtraining and they may be walking around all day long doing a Kegel or all day long sucking in their stomach, thinking that they're like improving their strength. And a lot of times, these young gymnasts, like, they're not doing yoga, they're not, doing other things to always balance that. And again, they're not tuned into that area. It's kind of like a foreign area a lot of times. So that's why what I see is just they're not aware that they're holding all this tension there and it's overused. Overused.
If they if they were, I don't know, just I'm assuming this is also a part of your treatment too, so please correct me if I'm wrong, but a part of it is kind of just learning how to relax the body, to breathe and to unclench your butt cheeks and to let your belly go and to wear sweatpants and not be zipping yourself up in tight jeans. Like, can it be as simple as that to create awareness?
Yeah, sometimes. Not all the time. But for some people, it can be that simple. For others, they do have to
Wow.
do a lot more direct techniques, like using a pelvic wand intravaginally to decrease
Okay,
the
yeah.
tension.
I have one of those, girl.
Okay, so you already know. Love that. Yeah.
Yeah, yeah, and that thing is yeah, it's like this purple
Yeah.
squiggly my PT gave it to me when I was pregnant.
Yes. Yep. Yep. So same thing. So some people may need a little bit more focused work on that, but or in
Mhm.
PT, I can help to do some mild fascia release of the upper muscles. But a bigger piece of most of the time is what they're doing at home, the awareness around it, managing any bowel issues that they may be having or any GI issue that they have because it's not ever, almost ever, just like one thing contributing to the issues. Jaw pain, jaw tension, foot issues, like there's so many things that I'm looking at with people.
Your jaw, your foot.
Mhm.
I mean, hold on. Hold on. And I know we still have to get to the 72-year-old. I can't move on yet because what please say more. Jaw tension, foot tension, bowels, like wait.
So
You're blowing my mind. Tell me more.
So there's definitely a connection between your jaw and your pelvic floor. There's an embryologic connection. There's a fascial connection. There's the visceral connection. So there's a lot of connections there. Connection. So studies have found that oftentimes if you're clenching your jaw, you're also clenching your pelvic floor and vice versa. And a lot of times it comes down to like where people hold their stress. Um, and it's often that those 2 things can be correlated.
Interesting.
Yeah, yeah.
Damn. Okay. So, what about now? Let's go up the lifespan. A 72-year-old, what might they be experiencing that they would see a pelvic floor physical therapist for?
So typically in geriatric population, it's urinary leakage and pelvic organ prolapse are probably the top 2. Also some rectal issues,
Mhm.
maybe fecal incontinence or rectal prolapse, hemorrhoids, anal fissures, things of that nature. And that can be whether they've had children or not. I think just with age too, you're more
Okay.
likely to have had some surgeries done or, more strain on your body or you're not exercising as much. So it's just more wear and tear on the body. But that's more so what I see in that population.
I have so many questions. I've like been in a room with you and I still have so many questions. Okay. So, for someone listening, we're literally only 12 minutes into this podcast and we are like we are in. For someone who has never been to pelvic floor PT
hmm
and they are suspecting that maybe there's some pelvic dysfunction.
A lot of times they're told they need pelvic floor PT. I feel like nowadays it's getting a little bit better that people are maybe a little bit more aware of these things and they go directly to a pelvic floor PT. But traditionally, they go to their PCP or their OB with an issue and they're like, okay, go to pelvic floor PT.
So they get a referral or they're told to go to pelvic floor PT.
hmm
And then what is the process of that first appointment? What can someone expect?
hmm so also Massachusetts is a direct access state, so you actually don't need a referral, especially for my practice, which is out of network. Um,
Okay.
So they would contact me or whoever, we would schedule the appointment, and then they get their intake form. And the intake form a lot of times is what helps them come up with like their thought process of what's going on. So during the first visit, we're kind of running through the intake form. So how are you doing mentally? How are you feeling physically? What aggravates your symptoms? What relieves your symptoms? What is your diet like? What are you drinking in the day? What exercise are you doing? Do you have pain with sex? Is it the pain at the beginning? Is it pain with deeper penetration? It's very detailed, very, very specific. Um, a lot of times people will say, "This is TMI." I'm like, "Nothing is TMI. Tell me more," is what that stands for. Tell me immediately.
Yeah.
So yeah, so it's a lot of that, and a lot of that subjective portion is very validating for a lot of people. A lot of times people feel like, "Am I crazy? Like, am I just making this up?" So that's what that part looks like. And then depending on the amount of time that we have in that first session, there's the external orthopedic exam. So that may feel more familiar. So that's where we're looking at your range of motion, your strength, your alignment, full body, checking for diastasis recti, checking for muscle tension. And then there's the optional internal exam. And that's when you step out. I step out the room, you get undressed waist down, and I'm doing a direct vaginal or rectal exam, which is always optional and with consent. Yeah,
Even though it's optional, do you recommend an internal
I
exam?
do. To me, that's what makes pelvic floor PT pelvic floor PT. Especially nowadays, a lot of clinics may claim that they do pelvic floor, or not even just like PT in the PT world, but a lot of people say that they do pelvic floor work. But unless you're trained and certified and have extensive experience in vaginal and rectal exams, like you're not really doing specific pelvic floor work because the whole point is that we don't know what the exact issue is. If we're not doing you can kind of guess, and with experience, you can kind of figure things out. But I don't know if you're leaking because your pelvic floor is too tight, or if it's too weak, or because the right side is harder than the left or stronger. Like, I don't know until we do that exam. So I do recommend it, but I'm definitely not like pushy or anything. It's totally up to the individual.
Yeah. I mean, it's definitely a little anytime anyone is going to do anything near your vagina,
hmm
you're just kind of like, oh, so
Yeah.
I can definitely understand and have been there too. It's like it feels sensitive. It's obviously very, very vulnerable,
Right.
but it's also, something that could literally
hmm
change how you experience life.
Yeah, I think a lot of times once people have made that first step of making the appointment, they're already like there. They're like, I'm like, let's just get this over with. Let's just get to the point.
Like, yeah, just
Um,
go.
yeah,
Yeah,
not everybody,
yeah.
and that's totally okay, but, most people know kind of, especially nowadays, that an internal exam is, like, recommended or a component to pelvic floor PT, but yeah, it's always optional.
All right, so let's go back to you a little bit and then we'll shift back to the practice in a moment. What are the ways that you have grown
Mhm.
since you were in PT school when you think back to taking those extra courses and getting that extra certification? What's the transformation for you?
Yeah, I mean, I feel like I've always been a confident person. I feel like in PT school and in school in general, I was just eager to learn more information. Um,
Mhm.
but, at the end of PT school, you feel like you know nothing. Like, you just went through these 3 years, you pass your boards, like, you know so much information, but you know nothing at the same time because you haven't really been able to fully apply it by yourself independently. So it can be a lot. Like, your first client, you're like, "Wait, what? What is back pain? Like, what is the glute muscle?" Like, you feel like you don't know anything, but you do.
Yeah.
Um, so I would say now I'm still that same person. I still feel like I'm a confident person. I'm still eager to learn, but now I am an educator. I'm a business owner, so I feel like I am now helping people that are like, starting off in their career. But at the same time, I'm still eager to learn. So it's just like an evolution of where I was, whenever that was,
Okay.
8 years ago. Yeah.
What do you want to learn when you think about how you most want to evolve in the field? What does that look like?
I feel like there's actually so many things I wanna learn. It's kind of like evolving, just like this d like, okay, like dry needling, for instance. Like, when I was in
Mm,
PT school, that was not this big thing. Um, like, I knew generally about it, but on all of my clinical rotations, I never had anybody in all of those clinics, nobody did dry needling. Now, it's, like, taken off, it's crazy. So that's one example, and then, like, learning at more advanced techniques of joining, like, there's just, like, more and more layers to everything that I already know. So I don't feel like I can ever
okay.
stop learning. Even with pelvic
Yeah,
floor, like, there's
that makes
more specific courses on endometriosis and more on fertility and more on stuff like
ah,
that, so you just can keep diving deeper and deeper. There's pelvic PTs that kind of focus in more things. There's some pelvic PTs that are really focused in, like, pregnancy postpartum. And then there's some that are,
okay.
um like, I have a colleague where her thing is, hypothalamic amenorrhea. Like, that's her category, which is, so a basic
What is
example of
that?
that is somebody that let's think of somebody that is, like, training for a, like, weightlift or bodybuilding competition, and they lose their period. So they go into
Okay.
that state. So that's her focus, and on, like, diet and fertility and hormones and wellness, like, that's her focus. So within the pelvic floor PT world, there's definitely different kind of like people that specialize in specific things. I'm a little
Mhm.
bit more broad. I like to touch on a little bit of everything. Um,
Right.
but yeah, there technically are different focuses within it.
Have you ever had any imposter syndrome, any like, what am I doing?
Yeah.
Any moments where you kind of doubted yourself or you doubted your skills or where there was a disconnect between where you wanted to be and where you were?
I would say maybe really early on in my career. But luckily, so right after PT school, I worked at Spalding outpatient, and the way that
Okay.
they do it is, like, you have a mentor. So it really helped with that. Like, I wasn't just, like, thrown into something. Like, it was
Mhm.
expected that you're gonna have question, it was expected that, you're gonna need help with certain things. So I never really truly felt imposter syndrome. Um
Yeah.
that maybe came on later, like, with my practice, it kind of started because I had clients ask me if I would, like, come to their house after having a baby, and, like, maybe that's where I started to feel a little bit I'm like, "You want me to come? Are you sure?" Like, I guess I could, but
Uh,
so I think that's more so where I felt a little bit of imposter syndrome, but not so much early on.
and then what about when you finally opened the doors to How's Your Pelvis? Like, did you feel like you were ready and sort of
Oh,
resolute in that decision, or did you jump a little bit ahead of being ready?
no. So I'm
What
very
was that like?
calculated. I'm very like, I'm not somebody that would just, like, quit my job and go cold turkey into a practice. Um, I just wouldn't do it, and it all kind of happened very
Yeah.
organically, and like I said, like, it kinda came on from people asking if I would come to their house postpartum early on. So I think that helped with that imposter syndrome, like, it was very short-lived. It was maybe just, like, the first 1 or 2 clients, and then I was like, "Oh, okay, yeah, this is cool, this is fine." Yeah.
So, like, tell me about the people who raised you and how you became this way.
So my family is fire. I do have to say, I am blessed with an amazing family, an amazing support system, an amazing husband, but I've
Wow.
also just always been that person. I've always been that way. Like, I mean, when I was like 4, I had this friend and she was like, "I don't wanna be your friend anymore." I was like, "Okay." Like, I've just always I've just always been that way. So I think that on
Wow.
top of having an amazing family, I think the combination of the 2 has contributed to that. I mean, not and then it's definitely not in like a cocky way or anything like that. It's just
Yeah, yeah, yeah.
those things like it's just, if something doesn't work out, it doesn't work out. If it wasn't meant to be, it wasn't meant to be. Like I've always just kind of been that like chill person. My
Yeah.
mom was a big she just retired, but she was a big businesswoman. Um, so I grew up seeing her, like, doing her thing and just, being in corporate America
Mhm,
and just excelling in
mhm.
that. My dad was a personal trainer. So he was an athlete and then he was a personal trainer. He has multiple sclerosis, so his career kinda ended earlier on. So he was diagnosed when I was 9, but his attitude up
Wow.
until this point, like, he's always just been so positive and encouraging and just he's just one of those guys, that, like, people always, like, look up to and kinda like that. So I just had a great support system. And then my husband too, like, he's always like, "Yeah, of course she's doing," like, he's very kinda similar in that way, like, very supportive. So, I'm definitely blessed in that way.
Yeah, for
And also
sure.
my
That's
parents'
so
friends.
amazing.
My parents, like, the community and my family members around me are all, doctors and lawyers and this and that and, work for the Red Sox. It's always I've been surrounded by that my whole life. So, I'm really
Yeah.
blessed in that way.
It sounds like a perfect like the poster child for what representation can
Yeah,
do
for sure,
for a young person.
for sure.
You know what I mean? Like it just becomes normal.
Mhm, absolutely. That's
So dope.
exactly what it was, yep.
Yeah, yeah. I mean, for me, it's like it it felt like in certain arenas, I could be sort of like out loud and ferocious, but like I felt
Mhm,
like it narrowed me. I have a lot of interests. I have a lot of things that I just like want to do and want to be. Um, and it wasn't until really like, if I'm like really, really, really thinking about it, it wasn't until my husband that he was just like,
mhm.
you're great. And I'm like, oh, me? Like, I am? Who? And I
Aw,
was like, okay, I'm gonna roll with that. I'm gonna believe
yeah,
that. And I'm just gonna,
aw.
you know, I'm just gonna expand. And I feel like that has been, you just need somebody to like give you permission to be like, fuck
You can
everything
do
else,
it,
just go.
exactly, yes.
Yeah.
Oh, we love
Yeah.
a supportive husband. Yes.
We do. We do. Okay, well, like, tell me about because you're also a mother. You're
Yes,
not just a wife. You're not
right,
just a doctor. You're also a mother.
yes.
So, how did your work affect your own pregnancy and postpartum experience?
I'm the worst patient. Mm, I I it's people ask me that all the time, like, "Oh, you must have had, like, a great pregnancy, a great delivery because you know so
Yeah.
much." And I always say, no, because 'cause I'm the worst patient." But maybe that's me being a little I don't know if naive is the right word, but not real acknowledging that, like, probably subconsciously, stuff to me that's so normal probably isn't normal to somebody else, or stuff that I just think of like, "Oh, my back hurts, let me just do this," So
Yeah.
in retrospect, I probably did do things, not even, like, thinking it was a big thing. Um, but my pregnancy was honestly great. I loved being pregnant. My labor and delivery was very long. She was sunny side up, wouldn't come down, so it resulted in a C-section. But, I think
Mm,
also working in this work, it helped because I've heard these stories. My daughter's 2, and I've been in pelvic PT for over 8 years, so I've heard these stories for, like, over and over and over again, so it made it normalized. So what may have been, like, a very
mhm,
traumatic situation for somebody, for me, it was very, technical and, like, okay, I knew this may
mm,
end happening, like, I kinda knew what I was walking into. Um so in many ways that helped because I knew
right.
of like 1,000 other stories similar to mine. And that's definitely a blessing in
Mm.
that way.
Would you say that you healed quickly?
Yeah, probably typical. Yeah, like I remember I was going on walks with her like 2 weeks postpartum and stuff like that. And it's, it's one of those things too where I personally have not actually experienced a lot of pelvic floor issues that I preach about. But
Yeah.
having a baby definitely helps with, like, the relatability of a lot of things, just like I did have pubic pain towards the end, I did have some back pain towards the end, C-section recovery and all of that stuff, so that definitely helped, but I feel like pre and post baby, I I felt pretty much the same in regards as, like, a pelvic floor PT and my ability to, like, educate and things like that, but having a baby definitely helped a little bit with the relatability factor.
Yeah, for sure. Did you
Yeah.
feel like there was anything that you kind of like assumed that would be true for you that wasn't? Like I know for
Mhm.
me, I assumed that even with the C-section that it would just be much easier because I was an athlete and because I had gone through 9 months of pelvic floor PT
Mhm.
and I kind of assumed that my body would not have as hard of a time as it did.
Hmm.
And I still can't I don't know if, like, a part of it was just, like, COVID and being isolated or if there were, like, other things that were happening, um, in terms of, like, medications that they put me on in the hospital, like, who
Right.
knows, like, what residual stuff,
Yeah.
but it was such a slap in the face because I was like, "Oh, you're just gonna, like, have a baby and then you'll just do your thing." And I remember the first time I picked up a barbell, I was like, "Oh my god, my stomach's gonna split open. Like, it's not gonna be okay." Did you have any any assumptions that were kind of, like, off?
I was surprised at how weak I felt, I would say. Um,
Mm.
and I feel like that kinda showed up later, like, with breastfeeding. I just felt
Oh,
so
interesting.
weak, and I think a lot of that was on me, like, I really wasn't exercising early postpartum. I wasn't probably eating correctly nutrition-wise with
Yeah.
breastfeeding. I was just in survival mode trying to, take
I
care of this
mean, listen.
baby and sleep and, like, still move my body. Like, I feel like just now, like, a year and a half, 2 years postpartum, like, I'm getting back into somewhat of a groove, especially with starting my own practice. I have a little bit more flexibility, but, um,
Yeah.
yeah, I think that's what would have surprised me is I feel like I lost a lot of strength.
Mm.
Um, and
What
but
do
it's
you
like
think
I knew I
you do to
would.
get
I
it
was
back?
right, yeah. It was kinda like one of those things, like, obviously, you're gonna lose strength if you're not working on it, but I definitely felt the weakness, like, "Wow, I can't, like, do a lunge, like, I'm all wobbly." So, that's probably what surprised me more
Yeah.
than anything in that regard.
What has your body taught you that your textbooks could not have ever taught you?
Yeah, your body is strong.
Girl, it's bedtime. Okay.
That's what I would say, honestly, even throughout all of that, like, with a long labor and, like, all like, I don't know, I feel like your body is just you have to give yourself a lot of grace because your body can go through so much, but you're still here, like, you're still walking and, like, doing the simple things in life, and yeah, I feel like the body is much more resilient than what could be taught. Yeah.
Mm. I think it's magical the
Mhm.
way the body is literally designed to keep you alive
Mhm.
is one of the most fascinating things.
Crazy.
Like, I'm so interested in like fight or flight and
Mhm.
cortisol and stuff like
Me
that.
too.
And like, I'm so interested in how some systems will shut down in order to allow other systems to take
Right,
the forefront. And I'm just like, this is crazy. Like, does
right.
anyone realize
Yeah.
how incredible you couldn't design this
Mm,
if you tried?
100%. That's how I felt like I remember when I was pregnant, I'm like, if you think about it too hard, it's like
It
mind blowing. Like it would be kind of tricky.
is
Like,
so mind blowing.
how did this like just I don't know. The whole thing to me is crazy if you think about it too hard. So yeah, I mean that's what I would
Yes.
say. Is like the body is so amazing. Like you said, like this crazy machine that can just adapt and flow and change and
Yeah.
yeah, no, it's crazy.
So incredible.
Mhm.
Who are you becoming right now?
Ooh. That's a timely question because so I just went full time at my practice in November, and I feel like
Congrats.
I thank you. I feel like I'm becoming more than what I thought I would be in a lot of ways. I never when I first started my practice, I truly thought it was gonna be like a side thing for a while. And it was like, nope, we need more hours, we need to get more people in. So I think I'm becoming, I don't know, just who I'm meant to be. I really feel like I'm serving in my purpose. And I feel like, especially with the educating piece and I feel like my mission is more than just my practice. And that's not something I ever really thought of before. So it's kind of cool. I'm interested to see what's coming next.
Yes. As am I, now that I'm a part
Yeah.
of your story, a part of your journey. If someone were listening to this and they had any inkling that they wanted to become a pelvic floor PT,
hmm
what would you say?
I would say do it. I mean, if you feel like you have a genuine interest, not just because it's so popular right now and trendy right now. Like if you genuinely feel like you are interested in this field, then you should pursue it. Because one, we need more. We need more pelvic floor PTs. Um and just you can do it. It's just like anything else and you'll start off slow and experience is huge. The more people you see, the more comfortable you are, the more familiar you are with things. I mean, when I first started, um I felt pretty confident seeing people, and then somebody mentioned estrogen cream. I'm like, "What's estrogen cream?" And now I'm like, it's such like a like I would be shocked looking back if I didn't know what estrogen cream is. So I think getting into the field, there's a lot of new language, there's a lot of new jargon. It can feel like a lot to keep up with at first. Um, but just take it in strides.
I want to go back to the sort of client side of things. And I'm thinking back to, I'm like literally actively in this moment while I'm on with you, reflecting back to the workshop that we did
Yes.
and some of the things that you were sharing that were just like gems, like nuggets of stuff that people could take with them like forever. And I
Mhm.
was literally in the bathroom at the gym with one of my girlfriends because we were getting ready to take yoga and I'm like yelling across the bathroom. Dr. Maya said, don't pee just because. Don't you shouldn't pee too many times. Like, do you really have to pee right now? And I'm so proud of myself for remembering.
Yes,
So
I love it.
can we thank you. Thank you. I'm like out here spreading your gospel.
Yes.
Um, can we talk about some of these easy things that people can do to help their own pelvic function, like a squatty potty,
Mhm.
like not peeing more than every 2 to 4 hours? Give us those
Those gems.
things.
Okay, so off the top of
Yes.
my head, let me think. I would say one big gem is to not hover over the toilet. So sit down fully on the toilet with an exception. I am not sitting on a what is porta potty. No. But majority of
You won't line the seat in a porta potty?
no, but majority of the time, make sure you're trying to sit fully down on the toilet. That will help protect your pelvic floor. Um, I would say normal for urination is every 2 to 4 hours. So if you're somebody that's peeing every 30 minutes, that's something to look into. If
Mhm.
you are somebody that has constipation, and you haven't worked on managing it, that needs to be managed. That is a big factor with pelvic floor issues. Like you said, just in case peeing. So if you're somebody that's peeing just in case, meaning you don't really have to pee, but you know you're going to Target, so you're going to try to pee, try your best.
Yes.
You shouldn't be pushing your pee out. So when you sit down on the toilet, you should just be sitting down and peeing. You shouldn't feel like you have to push and strain to get the pee out.
Mhm.
Um, what are some other gems? Oh, there's so many. There's so many.
I
Yeah.
know, I'm trying to think of, like, um, I wanna talk about poop one more time. Is it only constipation that we should worry about, or is
Oh,
loose stool a problem too?
I mean, both are a problem. Both are definitely a problem, but more so with, like, constipation, and if you're somebody that's straining on the toilet. I mean, neither are good for your pelvic
Mhm.
floor, but, um,
Yeah.
more of the population I see is constipation related. So if you're
Mhm.
somebody that's straining and, you have hemorrhoids and maybe you have prolapse or you're pregnant, like, that's definitely something
Mhm.
that we wanna try to manage and improve on. Loose stools, I do see as well. Like, I will see fecal incontinence, so they'll have leakage of feces, but not necessarily
Uh-huh.
because the stool is loose.
Okay.
Sense.
Okay.
But, yeah, I
Different thing.
definitely see those with diarrhea as well, but, yeah, more so towards constipation.
Okay. If you are experiencing any sort of leakage with, well, let me go back. Did you say that it might be more common with jumping, as in repeated impact versus running? Do I have that right?
I think what I may have been referring to is maybe some people feel like they can run 3 miles and they have no leakage, but as soon as they do a jumping jack, they have leakage. Yeah. A lot of times it's because it's a coordination issue. So running is very, like, fluid, whereas a jumping jack, it can be more jarring, and when your legs go apart, you're putting more strain in that area. I think that's what I was talking about.
Yes, you had such a great gem of like paying attention to the breath, right?
Mhm,
That trying to coordinate
mhm,
how you're inhaling and exhaling, like
mhm,
where the inhale and exhale is coming
mhm.
on the impact.
Yes.
So you would just play around with it.
Yes. So sometimes for some people, getting that coordination and timing down helps with their symptoms depending on what's actually happening at their pelvic
Wow.
floor, what the issue is. But yeah, sometimes that alone can make a huge difference.
And what about the people with young girls, right,
Mhm.
who play sports, who are gymnasts or
Yeah.
who are cheerleaders or
Mhm.
things where they're doing a lot of jumping and stuff like that. Is there preventative stuff that a parent listening to this could do, before dysfunction starts?
Yeah, so there is a whole pediatric pelvic floor world.
Oh,
Um,
wow.
yes, yeah, so there's 5-year-olds and 6-year-olds and, young kids
Wow.
in pelvic floor PT and OT. Um,
Okay.
but the population you just mentioned as well, yeah, I mean, well, one, for that age group, my biggest thing is periods. If your child is having extremely painful or extremely heavy periods, that is not normal. And, birth control may help to manage it, but there's still something that needs to be investigated as to why they're having those in the first place. That's like my biggest thing with that age group. Um,
Okay.
because a lot of times it comes up later. They get off birth control, they're 35, ready to have children, and they're like, wait, I have endometriosis? Like, I didn't know because the birth control was masking it.
Wow.
Um,
Wow.
yeah, so
Okay.
that would be a big one for parents. And then, yeah, like if your child is saying that they're having like leakage or constipation issues, like I would push for that to get further investigated as well. Yeah.
Is there anything that people get wrong when they hear pelvic floor?
Mhm.
Is there like, do you need to clear up any myths
Oh,
or
girl.
anything before we end this podcast?
Oh my
Like anything
gosh.
that you want to be like, please stop with the misinformation.
Yes, there's so many things. I feel a lot of people, including doctors, think that pelvic floor PT is just Kegels and just strengthening and that it doesn't really help. And maybe that's because they had some PT that was the case that they were doing with their client, but it's so much more in depth than that. That's probably the biggest one is that people think it's just like, "Oh, I do my Kegels every day." But, like, that's such, like, a tiny like, maybe a comparison for personal training would be like, "Oh, I don't need a personal trainer because I do clamshells every day." Like, it's such a small compared to, like, the bigger picture of what
Yeah,
we're
yeah.
trying to accomplish. Yeah, that's definitely the biggest one.
Do you recommend people do Kegels? Like, I thought couldn't you be tightening the muscle or overworking the muscle
Mhm.
if you're not doing it right?
Yes, yeah. It's very rare that I prescribe, like it's rare that I prescribe just isolated Kegels. Um,
Yeah,
it's so, like it's just so complex. But yes,
yeah,
people can
yeah.
definitely overdo it or, like, I think I during I think during the workshop, I was talking about, like, how you may see on Instagram, like, "Oh, do Kegels at every, like, stoplight or at every whatever."
Yeah, yeah, yeah.
But my thing is, if you don't have any pelvic floor issues, you do not need to be doing these things, and a lot of times it does not translate into function, like, when you actually cough or sneeze or lap, it doesn't translate in that way. So, yeah, there's so many
Interesting.
things. There's so many things.
Yeah, yeah. When I was doing a prenatal postpartum workshop, the visual was imagine you're sitting on a handkerchief
Mhm,
and lifting the pelvic floor. You're just gently lifting this handkerchief up. Like it's a
mhm,
gentle squeeze, gentle lift, that it's
mhm.
not this bearing down, you know, kind of thing, which changes the game because Kegel just feels like the complete opposite. It's just like, it reminds me of do you know those balls that you hold in your vagina? Do you know what I'm talking about?
Yeah.
I've never said these words on this podcast.
Yeah, so the weights, yes.
Yes, yeah, like that almost reminds me of a key, which is like
You're trying to hold it
hold
in.
it, squeeze it.
Right.
Yes.
Those I've only prescribed to one person in my entire career, and
Wow.
there's definitely, like, a time and place for certain things, and there are different ways and different versions of doing a Kegel. Like, there's one where you're just
Okay.
trying to nod the clitoral hood. There's the cue where you're closing the elevator doors at the opening and then lifting up, with the deeper pelvic. So there's
Ah,
different cues and things that, we do to try to encourage certain muscle groups, or if we wanna try to get the right side to contract harder than the left for different reasons. Um,
okay.
but yeah, a lot of times it's just really specific to each person. Like, that you can't just Google and be like, "Here's your" or on Instagram, everybody's selling their pelvic floor strengthening. Like, you ca like, it's so specific, much more specific than that.
Thank you for saying that. Thank you for saying that. Thinking of that made me think of another one of the gems, we kind of like talked about, which is you don't want to be sucking your belly in, flattening your belly, like you do not want to be sort of walking around braced all the
Right.
time.
So, a lot of people, like, feel the need to kinda suck in their stomach all day long, and a lot of maybe it's subconscious, or you maybe feel like you look better in clothing when you do that, but anytime you're constantly sucking your stomach in, you're also doing a little bit of a Kegel, so it can contribute to pelvic floor issues. Um,
Ah,
so I say let it
okay.
go. Let it hang, do your thing, contract when you need to contract, but the same way
Right.
I think I was saying, like, if you're standing in line in Target, like, why are you squeezing your butt so hard? Like, a
Right.
lot of times,
Yeah.
there's other reasons as to why somebody may be doing that. So there's a lot of awareness around that and trying to not do that as much. Yeah.
Yeah. Um I love this so much. What's one piece of advice or quote that you live by that you can give to us as a parting gift?
So, one piece of advice that I kind of, I guess, do kind of subconsciously is just to meet people where they're at. Like,
Mm,
I feel like that will take you so far. no matter what setting, whether it's your work setting or, you know, one of your friends, like try your best to just meet people where they're at. Like if I would actually say more so in the workplace setting. If you have a client coming and crying, you can't be like, "Oh my gosh, how's you like? Are you so excited?" Like obviously, you really shouldn't be doing that. But just meeting people where they're at and just, being able to really try to read people, read between the lines, to try to really understand what somebody's going through. I think that will really help with the connection that you have with your clients. Um, I feel like my mantra is kind of like release what no longer serves you. Um, you know, it- at the end of the day, if you are not well, you can't help people.
Mhm,
You have to, help yourself first before you can then help somebody
mhm.
else. So if there's something that's not serving you in your life, release it. And that's where I feel like you will see growth.
Amen to that.
Yes.
Thank you. So now you got to tell the people where they can find you, how they can follow you, book an appointment.
Yes. So, again, my name is Dr. Maya Lespinasse. My website is howsyourpelvis.com. My Instagram is at howsyourpelvis. And all of those links, the website and Instagram will link to my email, my contact page. I'm located in Foxborough, right off of 106. And yeah.
Also, I will say that Dr. Maya does a lot of pop-ups and stuff like in the area. So even if you wanted to just like learn a little bit more, meet her in person, all those sorts of things, like you are around, you're
Mhm.
collaborating,
Yes.
you're in the community.
Yep.
So there are so many ways that people can just like meet you and
Yes.
like get to know you better and all that stuff, which I think is really, really cool.
Yeah. No, 100%. I love doing that stuff. Yeah, even when I didn't have my own practice, I was doing that stuff. So, yeah, I would
Yeah.
love to.
So you never know. She
Yeah.
might be popping up at a gym or something near you. Stay tuned. Stay tuned.
Thank you for having me,
Um,
Ashley.
Thank you so much
Yeah,
for coming on the podcast, and I hope we get to work
anytime.
together again soon.
Definitely.
That was
Definitely.
awesome.
Yeah.
Yeah. Thank you. All right, everybody. Go follow Dr. Maya and stop squeezing your butt cheeks and sucking in your belly.
Mhm.
Sit down when you pee,
Yes.
and we'll see you next time.
Bye.